It is 8:42 now, and asthma is one of the most common chronic diseases affecting 1 in 10 adults, 1 in 7 children in Ohio, according to the Ohio Department of Health. And this makes May's dedication to asthma and allergy awareness and education just critical to creating a healthier Ohio. Dr. Ron Suprenant is the Buckeye Health Plan Medical Director. He joins us now with more on what we can all do to help. And thanks so much for coming in and talking about this. This has got to be an absolutely miserable time for people who have asthma and those who have allergies.
You're absolutely right. The allergies, pollen is high in the air, and so this is National Asthma and Allergy Awareness Month because this is a critical time for people.
Now people who suffer from allergies are probably a bit miserable, but for folks who have asthma, their lives are at risk if they don't maintain their protocols correctly, right?
That's exactly right. So patients who have asthma need to be sure that they're taking their medicine as prescribed, that they're monitoring for any triggers and avoiding those, and that if their symptoms get worse, they need to call their doctor.
Yeah. Now, for those of us who may live with someone who has asthma, we don't have it ourselves. Are there ways in which that we can be helpful to them?
Absolutely. So helping them monitor their triggers, avoiding smoke, for example, fumes like perfume or other strong fumes, paint, and then watching for any worsening of their symptoms. If they start getting a cough or a wheeze, shortness of breath, those are all signs that the person's getting worse.
Now, you mentioned how people who have asthma should keep up whatever medical care that they have. They should make it part of their routine and that sort of thing. Are there been any new developments, anything that makes that maintenance more easy?
Well, I think it is relatively easy. The biggest problem people have is that they kind of forget that this is a chronic disease that doesn't really go away.
Yeah.
So we have great treatment, but we don't have a cure. And so it's important for people, even when they're feeling well, to continue to take their medicine as prescribed, and that will prevent attacks.
Okay, what about resources if someone wants to find out more about asthma or about allergy and relieving the symptoms? Multiple
resources. There are all kinds of websites. BuckeyeHealthPlan.com would be one that they could look to, yeah. Certainly talking to their doctor or practitioner. All right,
May is Allergy and Asthma Sufferers Month, and we certainly know why. My black car looks yellow right now with the pollen and everything. Yeah. Doctor, thank you so much for coming in and talking about this.
Thank you.
All right, it is 8:44, and we'll be right back.